Okay. So, Dr. Peter Nakla, like I said, call me Dr. Peter, Dr. Nakla. Um, Welcome to AMP2. Some of you I've had before, I recognize names, okay? Uh, I had you in like micro, stuff like that. So, this course, neat course. Um, the lecture, the way it's going to work, it's a blended course. So, all the lectures will be online. The exams will be in person. I recommend that you come in person. It makes you a little more like, I don't know what's the word I'm looking for. Not responsible. You're more like in tune with what's going on. You're not distracted by with what's going on at home. I would use the ability to be online more as a flexibility, like, you got to take care of kids or something's going on. You got work, or as soon as class ends, you got to be there and you're close to home, something like that. Use it for that purpose. If you have to be at home, treat it like you're sitting in class. Remove the distractions. You'll have better outcome that way. Okay. Try and remove as much distractions as possible. So I teach quite a few classes. I teach Bio 1, Path Phys, Micro, AP2. I feel like I'm missing something. I teach AMP1. Um, and last semester with my bio students, they're an in-person class. I had them in lecture, I told them no computers, no phones. And they stuck to it. That was going to be our rule for the semester. We had the highest grades out of any bio class by removing the distractions. It makes a big difference. So if you can pay attention to the material, listening to it after you've already looked over it, you're 2 times studying it already, technically. Now you study it again. So repetition is key. This class is a big step up from that Bio 1 class, okay? For my people that did not do AMP1 here, um, no problem. This is a different animal, okay? Here, the level that they're requiring, the knowledge that they're requiring is more like master's level. Even though we're a 2-year school, what they're requiring for you guys to learn is pretty intense. The depth of what you need to learn is pretty intense. AMP1 was more memorization. AMP2 is more understanding. It's more physiology side than the um, anatomy side. Okay. So for me, I love AMP2. So my background, I'm an MD. I graduated med school. I didn't practice. I went into research and then I went on into teaching immediately. So I've been doing this since 2016, full-time here since 2016. I adjunct also on the side. So I was at GSU last year. I just started KSU. So a little variety of everything. All right. Um, you get to suffer through my poor dad jokes. Just warning you. Okay. So some people have already suffered through them. You guys, you're sadist for trying to do that again. Okay. But yeah, I like to bring relevance into it. So I like to use like stories, my experiences through my clinical work. My wife's a pharmacist, clinical pharmacist. She's actually the ID pharmacist at Northside, Maine. So there's always good stories to share that she shares with me. So I like to share that with you guys. Okay. So the way this class works, this class can be very easy if you do what needs to be done. All right. There's a strategy to it. Strategy is get your lecture notes. Can you hold up the lecture notes for us? I see you have them. Well, no problem. So the lecture notes, can I borrow it from you actually so I can show people at home? Thank you. So if you're not familiar with our system, get these lecture notes. You can only get them from the bookstore. So what we've done is we've taken that big old textbook and tossed out what we don't need you to know. What we're saying you need to know is in that lecture notes. We're saying you need to know 100% of it. Okay? We've reduced the material already. Don't go picking and choosing out of the lecture notes what you think is important, what's not important. You're destined to fail if you do that. The trick is fill out the lecture notes before lecture. I know today we couldn't have done that, right? You didn't know you need to do that unless you did AMP1 here and maybe jump the gun, right? Fill out the lecture notes beforehand so that when you come to class, you're listening and then you're filling in the gaps. If you try and fill it out afterwards, and you hit like you're stuck on something, and then you just assume that's what goes there. You don't know that you put the correct thing. So a lot of times I get students in these classes and they're like, well, my lecture notes are filled out 100% and I'm studying. Why am I still not doing well? And I start looking at their lecture notes and they have wrong answers. So yeah, you're studying, but you're studying the wrong thing. Okay. So that's a key thing there. How much you need to study depends. Every student depends. I know they like, who had Dr. Casey? Anyone have Dr. Casey? How many hours did he tell you have to study in AMP1? Per day. Was that enough?
I kind of did a little bit more.
A little bit more? It depends. 5 hours a day, someone said at home. It depends. Every student is going to be different. I'm going to get some students that say 2 hours was plenty. I did 2 hours and I was great. Some 5 hours, 3 hours, 4 hours. It depends. Okay. And be proactive. Set a schedule. Try to stick to the schedule. If you say, I'm going to do 2 hours today, and you get to that 2 hour mark and you say, I got the energy to do another 30 minutes, do the 30 minutes. Because what's going to happen later in the week? Friend's going to call you up, saying, let's go grab a bite to eat, something. You're going to waste some study time at a different point. Okay. Get ahead. Work ahead. Don't get too far ahead now. I had a student recently, sat down with him. He was, I think, 2 chapters ahead of me, and he started to struggle. And so I told him, I was like, dial it back. Just be just a lecture ahead of me. He did that, just hundreds. That was it. Okay? Be the lecture ahead of me. That's the trick. That's the strategy that'll really help you win at this class. Okay? Man, what else? I guess we got to go over safety stuff since some of you will be on campus. All right. So if there's a fire, we all have to leave together, be 300 yards away from the building. I got to check everyone off, make sure everyone's out of the building so a firefighter doesn't come in. In the event of a tornado, this is a safe room. In the event of active shooter, we lock the doors, turn off the lights, put your phones on silent, hide up here. Okay. Getting a hold of me, pnocla at gwinnettech.edu. That is the easiest way to get a hold of me. Don't click the email instructor option in Blackboard because that will email other instructors as well. You guys can't see it on your end, but the way we construct Blackboard, there's other instructors in other classes with us also, and so you'll end up emailing them. Okay? I respond very quickly. If I'm available, I get push notifications to my phone. It's like you're texting me. Can you confirm? Vivian emailed me yesterday, responded right away, okay? So if you get stuck on something, I'm here to help. That doesn't mean I'm going to answer every question in your lecture notes, right? You need to work through them. Where do you find the answers for the lecture notes? There's the text. So use our textbook. What else? What was the source that you used in AMP1? The internet. Be weary of the internet. Anatomy is vast. The physiology is vast. You can find contradicting answers. Okay? Sometimes the way you're viewing a question is different than the question's being viewed by someone else and a different author of a book, whatever. And so how they answer it actually may be different. And it could be correct in that situation. All right? The videos online. Dr. Schultz's videos, Kathy Schultz. So we have the links for those, the Vimeo videos. Go through those. So that's what you should be watching first. Using that to fill out your notes. And then you come to lecture, we fill in the gaps. And then what's the next resource we should be using? See, all of you went to it. STEM Center? Did anyone go to the STEM Center? No one? No one used STEM Center? Ah, you're killing me. Killing me, Smalls. Anyone at home use STEM Center? STEM Center is a great resource. You'll find fellow students in there. Oh, I'm blanking on her name. She was one of my former students. Shanice. I think Shanice usually mans the one here on Fridays. So she's one of our former students. She took AMP2. She's in the nursing program here. So she'll help you, okay? And you'll find that in the open lab room. So for AMP2, open lab is a must. AMP2, for your lab sections to have success in there, you need to go to open lab, Okay, go now. They'll post the hours this week. It'll open up next week. Go now before it's crowded. On this campus, it's very empty if you haven't gone to it, versus the Lawrenceville campus. It's just chaos. Expect this semester to get very busy. Our numbers have jumped as far as student enrollment. So go now, get it out of the way. Some of my like best students, they wouldn't go the 2 weeks before midterm, the 2 weeks before final, because they went early in the semester, they got it out of the way, and they were done with it. So they weren't stressing. They could devote more time to like lecture. They got the lab stuff out of the way. Some of that is blind memorization. When you talk about models and stuff, you can work ahead in that. All right. Uh, um, let's see. Anything else? I think that covers most of it. Any questions? No? Nothing? Nothing? Anyone at home? No? I don't see anything popping up. Yeah,
How much different would it be if we're taking the lab somewhere else, like in Lawrenceville?
no difference. So the question, in case you guys couldn't hear at home, if you're taking the lab somewhere else, if it would be different, there's no difference whatsoever. Oh, sorry, I couldn't see that. Actually, stuff was on the chat. We are standardized, so it doesn't matter who you take for lecture, who you take for lab, it's all the same. Okay. So yeah, the video, the soft truck. Do we still have the soft trucks? I thought they pulled the soft trucks down. They may still have them. They may have the documents. We got rid of the quizzes. I don't know. I did that a while ago. It's been a while. Okay, so yes. Um, so the soft trucks are also like Word documents for you to work through to help you prepare filling out the notes, the lecture notes. Okay, in case you're not familiar with those. And who are you taking for lab?
Well, 10 a.m. class.
No worries. It's all one and the same. Okay. Yeah. Don't stress about it. But if you're going to be here on campus already, that's the only reason I recommend like switching to my lab. It's no difference to me.
I just can't do that time.
Yeah.
Thinking Marissa?
Okay. Yeah. She's good. You'll have fun with her.
Okay.
All right. Um, let's see. So we're gonna hit the ground running. So if you guys have computers with you today, to access these slides, that's the only thing. If you do, you guys all have a computer? Yes, no? Yes? Yay, nay? Okay, cool. So, what do I want to share? Hold on. I gotta pull up my PowerPoint back. Come on, computer. It's been a little slow today. So another thing that's, in this course is different is that participation, we've done it for our whole department, counts. Okay. So starting next week, I will take attendance that counts for up to 5 points on each exam. Okay. The 5 points makes a difference. We've had students that missed that A because they weren't attending. They were off by a couple points. I think in the end it equates to like 3 point something percent overall, like on your grade. So attendance is important. Be on time. Okay. So I'll start taking that next week. So don't worry about it this week quite yet. Okay. PowerPoint, share. So we don't post our PowerPoints, but there is like a generic version on there. They all stem from the same place because we're standardized. So don't stress about that. Okay. Also, as far as the videos go, Dr. Schultz's videos, don't just sit and rewatch and rewatch and rewatch. You won't learn that way. Okay? You could watch a movie 10 times over. Do you know every word and every line in the movie? Unless it's Dumb and Dumber, right? Everyone knows all those lines. Um, but how did the actors learn all the lines? They read it, they practice it, they studied it. So that's how you got to treat this course. When you're trying to learn the material, don't just watch the videos endlessly. The video, watch it once through in the beginning to fill out your lecture notes. After that, if you're stuck on a topic, rewatch that section, that little bit. Okay? And that's how you maximize your time. So studying is all about efficiency of time. And take breaks. There's nothing wrong with taking breaks. It's hard to do the marathons. Can you do the marathons eventually? Yes. It takes time. Okay? I used to take like 30 minutes of studying and then I take like a 10 to 15-minute break and do something mindless. Like I'd have a TV show, just turn on the TV and watch something dumb, 10, 15 minutes and then come back to it. And eventually what you'll notice is you can stretch that 30 minutes to 45 minutes, an hour, and you go longer and longer. And then the amount of time you can stack in grows what your tolerance to it is. Okay. Got to the point where I'd go like 4 hours straight without moving. It was so bad I had to go see the eye doctor because I couldn't see appropriately anymore. My eyes from focusing on like the text actually strained the muscles. And I would like hours later, my vision was all blurry, all funky. Um, and so that's what it came down to. It was just straining of muscles. So I had to take a break and like incorporate breaks for that reason. But it takes time to work up to there. You can get there. Just don't say I'm going to study all day on Saturday and you didn't study all week and you're not going to be able to do it. Okay. All right. So AMP2. The difference between AMP1 and AMP2 is that in AMP1 you were studying like individual cells. Now we're going to take all these different cell types and build them into tissues, organs, and we're going to study the functions of the organs. We're going to study every layer of the organ. So you're going to learn all of the layers. You'll do drawings in lab just like you did in AMP1. And then the physiology side. Why does this happen? How does this work? What happens when you do something here in the other part of the body? So when you think about the body and its function, it's not on-off switch. It's kind of like yin and yang. Like sometimes we'll turn the system up a little more and then turn it down to get a reaction. But both sides of the system may be working. Okay, um, it's not one or the other. It's kind of like sympathetic and parasympathetic systems. Both are always functioning. But in like fight or flight, the sympathetic just turns up more. We don't turn off parasympathetic. Okay, there's just the other overriding system becomes dominant. So we see that all throughout AMP2. So be mindful of that as we study it. If you speed up the heart, your heart starts racing. What's something else that may happen in your body because your heart's going faster? Breathing may speed up. Okay, whatever's stimulating the heart to speed up. So if we release fight or flight, we released adrenaline into the body. Your heart rate's going to go faster. Your breathing's going to go faster. Anything else? What about your pupils? They dilate, right? They dilate. What happens to your GI tract? Turns off. If I'm running from the tiger, I don't want to be worried about having to pee. I don't want to, worry about being hungry. I'm running. Okay. So you'll see that all throughout here. All right. This first section is a little bit of a monster. Not because it's difficult, it's volume. So today, start studying, start filling out those lecture notes, get ahead of it. It's a lot of material. I think it's like 120 slides for digestive. It is a big chapter. Okay, so get ahead, start off on the right foot. I forgot to mention because some of you are new here. Sorry. Homeworks are online. They are one attempt. When you start them, the timer runs. If you close your laptop and walk away, the timer is still running. I cannot open them. If you've missed them, they're hard deadlines. That is out of my control. So be ahead on those. Hold on. Let me show you something. What is going on here? Sorry, I forgot you guys. Some of you are new here. Where is screen share? There we go. Okay, so Blackboard. Under Blackboard, you'll find our course calendar. So we're the Monday, Wednesday course. Download this, go by this. Do not go by a calendar on Blackboard. It will glitch, it will throw you off, you will miss assignments. So on here, it'll list what we're covering in lecture and then when the homeworks are due. They're hard due dates. We dropped the two lowest. Blackboard automatically does it. You don't need to email me. Okay. All homeworks are open from now. They're open book. You can work together. I recommend that. Make a group me, whatever you guys want. Work together. You'll have better success. Okay. So you'll see we have 4 exams and a cumulative final. So everything from today on is fair game. And then also under start here, you'll find the syllabus. Go through it. You'll see the instructor policies, all of that. Okay. And then under lessons, you'll find lecture policies, policy quiz. You must do this so you are not marked as a no-show. You have to do it for lecture and for lab. Separate one for lab. That's what we'll use for no-shows. So please do that today. When you do that, it'll unlock the entire course for you. So you can't even see anything. You can't see homeworks, lessons, nothing until you do that. And it is literally, did you read the syllabus? Yes or no? Okay, so one click, move on. All right, so please do that today. There's StudyMate on here. Use these more as a quiz for yourself. That's the technique with this. After you've studied, go through and see what you get wrong. Study those topics, not the one little thing, the entire topic. Use that to help your efficiency when you're studying. Okay. Let's see. And then if we click on lessons, under here you'll find those video links. There's those PowerPoints, the soft chalk PDFs that will help you just to fill out your lecture notes. There's a soft chalk quiz. It doesn't count for a grade. Okay, we removed that as a grade, so you can use it once again to gauge where you're at in the material. And then there's your homework. So 90 minutes, plenty of time to work through it. Remember, it's one attempt. Once you open it, timer runs. Okay. So if you're, like in my lecture, for example, and you have my lab and we have that gap, what you could do is you get a group of you, sit down, open up the homework, work together. Okay, maximize your points on that. There's no problem with that. You'll get different questions because it comes from a test bank. So don't be surprised or caught off guard by that. Okay. Let's see. I think that's everything to cover. Yeah. Okay. So back to this guy. I need to. There we go. PowerPoint. There it goes. All right. So digestive system. So sometimes when we're working through here with the anatomy stuff, I may not stress it too much because I know you're going to cover it more in lab. And I'm not worried about that. And I try and focus more on like physiology, that understanding portion. Okay. So we have what's called the alimentary canal and accessory organs. So during embryology, when you're forming, you're actually kind of like a sandwich. There are 3 layers. In those 3 layers, there are 2 holes between 2 sections of it. So you got 3 layers like this. There's a hole here and a hole here. So you have what's called ectoderm, mesoderm, endoderm. They're the 3 like original stem cell layers. Between the first 2 layers, ecto and meso, is your cranial canal. That's where the brain and brainstem goes. Between meso and endo is the alimentary canal. So you form the gut tube. You literally have a hole from mouth to anus all the way through the body. You are a human donut. That's why we like donuts so much. Okay. The accessory organs are organs that help with digestion. So, for example, the liver. You don't think about it, but the liver is actually part of your digestive system. Creates bile. The bile helps break down fat so we can absorb it. Your pancreas, that's part of digestive system. That's where a majority of the enzymes for breakdown of food come from. So we'll talk about like amylase, lipase, all of those. Okay? And we'll work through that. So alimentary canal, that's where the food is traveling through. Our entire purpose for eating is what? Why do we eat? Because it tastes good. Unless my wife's cooking. I'm just kidding. I'm just kidding. I have really bad jokes about my wife. And I tell them all to her. To absorb nutrients. What are you going to do with those nutrients? Why do we breathe? Why do we eat? What do you make? ATP. No one had Natalie. Hey, Natalie. I know Natalie. We make ATP. What's ATP? Energy, right? Without ATP, you're dead. You're actually at rigor mortis. After death, when the body starts to seize up and the muscle seize up, that's because of lack of ATP. Remember the calcium in the sarcoplasmic reticulum, and you got to pump it back in to relax your muscles? That's why that's happening. You lack ATP to pump it back in. So we literally eat and breathe to make energy. Okay? So when I eat a steak, it's protein and fat, right? I can't just pull it in. We have to break it down to what's called the monomers. So part of going through the digestive tract to break it down to the individual blocks is churning, of the stomach, the acid in the stomach. That helps break down protein. When we get into the small intestine and the pancreas releases all its enzymes, that's where we really break it down. That's where we start to absorb. It takes a couple hours. We'll see it takes up to 4 hours. You eat something, it takes up to 4 hours to break it down and absorb it. We then can start building it into ATP. We can use those nutrients for cell structure, whatever we need. Okay? So digestion is that breaking down. Absorption is pulling it into the bloodstream. And we're going to go through all of this. But what we'll see is, we pass through the mouth, we pass through the esophagus, we go to the stomach. From stomach, we go into small intestine. So we have duodenum, jejunum, ileum. Then we go into large intestine, ascending, transverse, descending, and out. Once we hit large intestine, it's stool, it's feces, it's waste. Okay? So in that section of small intestine, that's where we do the breaking down, the absorption, and we pull it into our system. Pharynx. So we have 3 sections of pharynx that we look at: naso, oro, and laryngeo. The structure for each is different. We'll look at that. Here we can see small intestine. So we have duodenum, jejunum, and then ileum is the last section. And then we go into large intestine and it becomes waste. Okay. Yeah. Are you on WebEx? No problem. Give me 1 second, guys. So are you on Blackboard? Sorry. Rest of you got it? No? You see it? No? So if you go to Blackboard, virtual meetings, and then click join. Sorry. It's a new system, so it's not the clearest. You able to see it now? Yeah. Okay. Oh, you got to download an app? Okay. I'm recording this, so I'll work on trying to get this uploaded for you guys, but Should be able to, I thought you can join without it, without the app. It's on your, by the time I get it pulled up on this, you'll have it anyway, so give her a second. Oh, you had to download the app too? Okay. Someone else had to download the app.
I'm sorry, you said Blackboard and then what?
And then under, is it start here? Is where WebEx was or lessons? Start here
Just a tab that says WebEx.
and then click on WebEx.
Oh, okay.
Cool, cool, cool. Give it a second, download.
We automatically have a WebEx? Sometimes just, I know.
You should,
Click on the virtual meetings.
yeah, click.
Just click join the first meeting.
And you should see like every class listed.
Join, okay.
So click the first one, join. I don't know why we switched to WebEx. Just, it had to be cheaper. That's the only logical thing, right? Which is nice for you guys, right? It saves tuition money. It's always a good thing. Are majority of you going for nursing or yes, no, yeah, no? What are you going for? Rad tech. Very cool. Sonography. Okay. We get a variety. I know here at Gwinnett Tech, a lot of people go for nursing. It's popular. Right? I couldn't do it. Couldn't pay me enough. All right. Able to log in now? Got it? Cool. So, oh, someone's mic is on, if you don't mind. Ah, there we go. No, still. Yes, hello? There it goes. I hear myself through here. I don't know if you guys could notice that. There we go. So yeah, the large intestine here. So we have appendix sitting down here. We used to think the appendix was useless. Just take it out of people willy-nilly. Now, if they get appendicitis, we try and actually treat with antibiotics first before we go for removal. If it ruptures, well, it's a medical emergency because now there's bacteria in here. That's a big problem. And then it does have to be removed. But we've learned it has to do with the immune system. There are aggregates of white blood cells there. We'll talk about those later in the semester. And then after that, we enter into the large intestine. So this is the ascending, transverse, descending, and then we have sigmoid and rectum. Okay. So like when they do a colonoscopy, for example, this is what they're looking at. They stick a tube in there and they have a camera and they inflate it with air and they go all the way, all the way, all the way to here. And they can even peek in the ileum a little bit. But after that, it gets pretty small, so they don't use that equipment to go in that way. Usually, if they want to peek at the small intestine, they actually go for the mouth. They do an endoscopy and they can peek into duodenum a bit. And then after that, they actually have a little pill you can swallow, and it's a camera. And it goes through, and then the patient collects it, they upload the data, and they view it that way. That is pretty neat. Not the most efficient because as the pill rotates around, it may miss something. So that's why they don't prefer to do it, but it is an option. All right, so accessory organs, these don't directly play a role in absorption, but they do play a role in digestion, the breakdown of food. So like teeth, for example, they mash the food to break it down into smaller pieces. The tongue helps manipulate and create what's called the food bolus. So when we swallow that chunk of food with the saliva in it, and it's starting to go down into our system, gallbladder, we'll see just concentrates bile. What's a concentrate? What is, if something's concentrated, what does that mean? I like to ask a lot of questions, so get used to it. Anyone at home? It means to focus, right? I'm just kidding. What's concentrate? When something's concentrated. You buy like bleach. Do you put straight bleach on stuff? You shouldn't. Why do you not need to put straight bleach on stuff? You should mix it with water. What does that mean? It's concentrated, it's very strong, okay? It's very strong, so we need to dilute it, okay? So that's what the gallbladder does to our bile. The liver makes the bile, the gallbladder takes it and makes it concentrated. So this very potent amount. And so when we eat food, specifically fat, we'll see the gallbladder will contract, push that concentrated bile out, and that'll help break down the fat into small little globules, okay? Small little myceles is what they're called, and we can absorb it. It works kind of like a soap. We'll talk about different digestive glands when we work through them. Salivary glands, we actually have enzyme in them, amylase. So the enzyme amylase breaks down carbs. So we actually start to break down carbs in our mouth. Put a cracker in your mouth, and you just let your saliva sit on it. The cracker will start to dissolve. It's not necessarily because it's getting wet. It's all, the enzyme is starting to work on it. Okay? What are enzymes made from? Fat, carb, or protein? Protein. What destroys proteins? Heat. What else? Temperature. Change in pH. And salinity. I don't think we really teach the salinity point too much, but that destroys it too. That's why you do like salted foods to preserve them. The high salt content destroys proteins, so like organisms can't live on it. That's why I like ceviche. You hit it with that acid, the lime, all of that, and it's safe to eat. Okay? And then our food in general, we heat it, we cook it, and that destroys all the proteins, so it destroys all the organisms. Okay? If we lose structure, we lose function. So that amylase that's in your mouth, when it gets to your stomach, does it work anymore? It doesn't work anymore because what's in your stomach? Acid. Very potent acid. It's about 1 to 2 on the pH scale. Very potent. Okay. So it works for a little bit, and then once we get into the small intestine, the pancreas will dump out real amylase. It will really break down those carbs. Okay. Liver makes bile. We're also going to see on the absorption side, once it enters our bloodstream, that's the first stop. After we absorb the food, it goes to the liver. And the liver starts to process, glucose, make it into like glycogen, send it to different parts of the body. It's going to enter into the bloodstream. Well, it's already in the bloodstream, but it's going to continue on in the bloodstream, go to our heart, lungs, back to heart, out to our body. Okay. So it takes it a little bit when we're absorbing things. The liver will also work on like detoxifying chemicals. So like if you drink alcohol, goes to your liver. That's where you start to break it down. Okay. Hence why the liver is the first thing to get damaged. So a lot of times when people take like drugs to overdose, first thing to get shot, liver, right? Kidneys as well, because that's the exit point. So on the way out, accumulates in there, destroys the kidneys. So it's rather unfortunate, especially with like Tylenol overdose. My wife sees those from time to time. And it's always a sad case because it's typically like your 16, 17-year-old girl. That's the common person you see that does like the Tylenol overdose. And they destroy their liver. Poor decision, something they got to live with for life. Can you live without a liver? It is a very fast death if your liver is dysfunctional, right? Typically, if there's a suicide attempt, you do not qualify for a transplant either, because it's hard to come by organs, and you are too risky for them to give you that organ. Same with alcohol abuse, drug abuse, stuff like that. So it's rather unfortunate. A few years back, we used to live in a townhouse on the other side of town, and we're sitting there, my wife and I, and all of a sudden we just see them front of the house just lighting up, red and white lights. We're like, what the heck's going on? Poke our head out. Our neighbor's kid did that. She took a bunch of Tylenol. They were loading her up into the ambulance. So hopefully they caught it early enough, right? If it's in the stomach, we can pump the stomach. We can go in and try and pull it out. But if it's in the bloodstream, there are certain drugs you can give to try and bind them, get rid of them before there's assault on these organs. So, anywho, right? Pancreas makes a lot of enzymes. What else does pancreas do for us? Makes a really important hormone. Insulin. And there's another one. It's the antagonist to insulin, glucagon. Without insulin, can you live? You're a type 1 diabetic. If you don't have insulin, you're a type 1 diabetic. If you have insulin dysfunction, and we'll learn about both of these, you're a type 2 diabetic. Okay. And then we have prediabetes. Hey, recently. I'm on metformin now. So much fun, right? Genetics. Genetics. I blame my wife. I'm telling you, we both started gaining weight after we got married, and we figured out what it is. You're sitting on the couch, you're watching TV, you're minding your own business, and one of you gets up and you're gonna grab a snack, and you're like, "Hey, do you want something?" You're like, "Oh yeah, since you're up, I'll take a snack." Or it's like you're saying, "You want a beer?" "Oh, okay, I'll have a beer or a glass of wine or something." Like before you didn't, right? Like you're just motivating me to gain weight, and now I get yelled at. She's like, "You need to lose weight. You need to work out." Dang it, right? So much fun. 'Tis marriage. All right. So your pancreas, you cannot function without your pancreas. What's wild is we talk about insulin and the diabetes, and that's such a big deal. That's actually about 1% of the function of the pancreas. 99% is the exocrine function for digestion. Without it, you cannot absorb the food. That's really what it's going to come down to, because everything you eat will not get broken down to the monomers, and you won't be able to absorb it. Okay. So you see that in patients with, it'll come to me. Their lungs are clogged. They did a movie about it. They wear the vests that like shake their chest to break up the mucus plugs. Cystic fibrosis. Thank you. It's in there somewhere. Just was it 5 feet apart? I think 5 feet away was the name of the movie. Pretty good movie. So cystic fibrosis, they actually have a dysfunctional transmembrane protein. A protein. A little pump is dysfunctional. Because of that, they don't pump out chloride ions. Water can't follow. So the mucus is viscous. So it clogs their lungs, clogs their pancreas. So I met a guy not too long ago, cystic fibrosis. He found out, he said something, and he was like chatting with us, and he's like, "Oh, what do you guys do?" Whatever. And so once he's like heard what my wife and I do, he's like, "Oh, so you'll know about what I have." And he had cystic fibrosis. So he was telling us he started on a med that is enzymes. He's taking these enzymes, and he's like, finally, I was able to I gained 30 pounds. I'm normal weight now. He was underweight the entire time because even though he's eating, he can't fully absorb it because of the lack of enzymes. But my wife was telling me afterwards, it was something like $10,000 a month for those enzymes. Man, very pricey. But you got it. Insurance covers it. He would be considered like he's disabled because of the disease, because of risk of infection, stuff like that. It's very tough. Anywho, salivary glands. So what's exocrine versus endocrine? What's exocrine mean? Exo? Is it in or out? Out. It exits. Okay, secretes out. And then endo? Into what? Exo is out of the body? Into the blood. Okay, correct, Natalie. So endo is in. Okay, so when we talk about like salivary glands, we got the parotid, sublingual, and then submandibular. Exocrine, they secrete out of the body. Okay, so it's into the mouth, but it's considered out of the body. If it's out of the bloodstream, it's out of the body, it's exocrine. Pancreas, like we mentioned, exocrine and endocrine. pathways. So exocrine will be all the digestive enzymes. Those will go into our duodenum. And then endocrine would be going into the bloodstream like insulin, glucagon. We'll talk about those later in the semester. Liver, gallbladder, they are more considered exocrine. They do have endocrine jobs as well. Gallbladder is 100% exocrine. So he's going to be concentrating the bile and secreting the bile out into the duodenum. So here they show the parotid, which is on the side here. Sublingual is under the tongue, and then submandibular under the mandible, okay? So stomach would be up here. This is duodenum, curving around. There's your pancreas. Liver would be floating up here, and then gallbladder. So we'll learn the liver makes the bile flows down. If what is called sphincter of Oddi closes here, the bile backs up into the gallbladder, we concentrate it, and you store it for later. Okay? And gallbladder does not make bile. They're showing here like gallstones. So when patients get gallstones, the problem with it is, one, it backs up, gallbladder starts to hurt because it's contracting. There's all this built up pressure in it because it's so full. And so they get what's called referred pain. It's actually over the right shoulder typically. When they eat like fatty meals, the gallbladder goes to contract. It can't, the pressure is extreme in there. Because of how the nerves pass, that's where they typically report the pain. The other issue is it causes pancreatitis. Because the common bile duct merges with the pancreatic duct, if it blocks here, it actually backs up all those enzymes into the pancreas. It starts eating itself. That's pancreatitis. The enzymes start breaking down the pancreas. Once a patient develops pancreatitis, they're high risk for repeat pancreatitis events. Okay? So once you have one event, which is acute pancreatitis, you are at high risk for chronic pancreatitis. It's incredibly painful. Pancreatitis, patients will refer, the pain feels like someone's taking a drill right about here and drilling all the way through them to their back. That's what it feels like when they get the attacks. Incredibly painful. Remember, there was a girl when I was on my GI rotation. She was like, I think she was 19 years old. She had chronic pancreatitis. Idiopathic chronic-pancreatitis. Idiopathic in medicine means we don't know why. It just happened. Sometimes that's just the way the body is. It just happens. There's no reason for it, okay? For it to be triggered. You see pancreatitis a lot of times in alcoholics. Very common. And then as well as like in CF, cystic fibrosis, you can see it. All right, so here now they're showing the liver. With AMP2, you need to be mindful of rights and lefts, so it's always the patient's right and left. It's very important. Accidents have happened in the past, right? Amputated wrong things. It's happened. I had surgery on my knee a few years back. The nurse came in, asked me which knee. The anesthesiologist came in, asked me which knee, and then the surgeon asked me before I went under which knee, and all three signed on my knee to verify which knee they're working on, because accidents have happened in the past, right? So remember, be mindful of that, especially when you guys starting models, right, left, okay? In the lab manual, it'll tell you, like for vessels, stuff like that, when you need to know right and left. But just get in the habit of it. It's something you guys will use in your field. Whatever field you go into, you'll be using right and left of patient, okay? So, digestive, as far as functions, we'll see ingestion, that's actually just eating, taking the food in. Deglutition, that is swallowing. And then we'll go into digestion. We'll talk about mechanical, so that would be like the stomach churning it, the teeth mashing it. The chemical would be the acid, the enzymes, absorption, pulling it into the bloodstream, and then defecation, that's getting rid of the waste. So they have a nice little overview here that you can see, churning it, passing it through the small intestines for absorption, and then eventually fecal matter in the large intestines and waste. All right, so ingestion, that's taking the food in. Mastication, chewing, okay? We're mixing it with saliva and we're getting it ready to be swallowed. We'll see. What's the difference between skeletal muscle and smooth muscle? Skeletal muscle is voluntary. So, like muscles of mastication, the tongue, the beginning of the esophagus, they're all skeletal. After that, smooth. Do you control smooth? No. So we don't want to think about it. Once I swallow and I get it past the first like 1/3, that's it. It's on its journey. Through my GI tract, I don't have to worry about it. It's going to do it on its own. It's going to move it all the way until I hit another skeletal muscle. That is the sphincter in the anus. I control that. Okay? For now. When we get older, not so much, right? Okay? We control the beginning and the end. That's it. Everything else, smooth muscle, it passes on its own. Okay? Using the tongue, the saliva, we create what's called the food bolus. It's just like a amount that we're going to swallow that is wet with saliva. Like we mentioned, teeth, just for grinding, mashing. Okay. Deglutition, so this is swallowing. It is voluntary. We choose to swallow. Okay, so that means it's skeletal muscle. They list a couple nerves here. You should know which is motor, sensory. Be mindful of that. So we have trigeminal. And for test purposes, sorry, we didn't talk about the tests either, how they're set up. My bad. 50 questions, 30 multiple choice, 20 short answer. Okay. With the short answer, things like this where it says trigeminal or cranial nerve 5, you need to write trigeminal. I need to know that you know that side of it. Okay. When I look at the key for the exams, it'll tell me to mark off points if you put cranial nerve 5. Right. So be mindful of that. And then the final exam, 100 questions, 70 multiple choice, 30 short answer. I do not make the tests. They come from a test bank. They're sent to me. Usually I don't even see your test till about 30 minutes before your class, right? So that's why the classes are standardized. Yeah, so yes, Natalie, just name the nerve. You don't need to name the number also. I need to see the name of it, okay? So be mindful as you guys are studying, right? Facial, so that's cranial nerve 7 and sensory motor, glossopharyngeal, also sensory motor, and then hypoglossal is just motor. All right, so the 3 phases of swallowing. Whoops. So the buccal, that is voluntary. That's in our mouth. We are choosing to do that. Pharyngeal is the beginning. So we're in the oropharynx, also voluntary. Esophageal, the very beginning of it, the 1/3 voluntary, meaning it is skeletal muscle. After that, we're going to transition over to smooth. We do not control it. So when we initially swallow, we have the soft palate lifting up, and that's going to block the nasopharynx. We don't want food going up, okay? So who's controlling this? Trigeminal, glossopharyngeal, and then epiglottis. The epiglottis, when we look at, can you all see the word? It's kind of, if I'm right here, can you guys see this? Is this big enough? Yes, no, yeah, yeah, okay. Oh, this is horrible. Hey, I made it. Okay. So there are 2 tubes that we need to talk about when we swallow. One is the esophagus. This is where food should be going. Okay, so esophagus. We want food to go through there. The tube collapses down if nothing's passing through it. It's not just staying wide open. So with all your GI tract, it doesn't just stay wide open. It's smooth muscle. It just collapses on itself. The other is the trachea. We do not want food going in the trachea. That is our airway. That is our windpipe. That's what you feel right here. Okay? It's cartilage here. You guys looked at this. If you took our A&P1, when you looked at hyaline cartilage, that's what you were looking at. Those little rings. You saw like little patches of hyaline cartilage. That's these rings. And when you looked at pseudostratified ciliated epithelium, that's where you were looking at. The same tissue, okay? So the epiglottis is a little doorway right here. When you swallow, that doorway closes. If it doesn't close and stuff goes in there, what happens? You choke, and what do you start doing? Gasping for air. You cough violently. You know when you swallow water and it goes, or something, and it goes down the wrong pipe? You start coughing violently. That's what happens. Someone's made it in here. So your body is trying to contract your lungs very rapidly to create velocity and push it out. The reason being is in here, no bacteria. If bacteria makes it down here, gets into your lungs, what do you develop? What's an infection in your lungs? Oh, you know this. I know you know this. You just don't know you know it. Pneumonia. Thank you, Natalie. Thank you, Liz. Pneumonia. That's how it ends up happening. So a lot of patients that are on trachs, so you got to suction them. If they're intubated, you got to suction them because it's now a pathway for things to get down there. They're paralyzed. They're paralyzed. Gag reflex doesn't work. That coughing doesn't work. So bacteria slowly migrates down and they develop pneumonia. Okay? So that's why it's important to do that. You see lack of gag reflex in alcoholics because it destroys that portion of the brain over time. So you'll see them, they'll have aspirational pneumonia or aspirated pneumonia. They'll breathe things in that they shouldn't be breathing in. It's making it down there, develop pneumonia, okay? So the epiglottis folds and closes off that respiratory tract so we don't get infections. Okay? So that's what they're showing right there. And there's our food bolus migrating down the esophagus. So when we enter into the esophagus, we start to talk about a new term, and that's peristalsis. Peristalsis is this sequential contraction of smooth muscle to move the food bolus along. Peristalsis function is just to move food. In the esophagus, we do no absorption. There's really nothing happening in the esophagus other than the little bit of amylase that you had in your saliva is working on carbs. That's it. No other event in the esophagus. It is a tunnel to the stomach. That's really its entire purpose. Okay? There is also sphincters. So sphincters are where we see a wrap of muscle that'll close off a pathway. It'll open and close as needed. So at the top of the esophagus, there's the upper esophageal sphincter or UES, and it closes off, like right now, closed. It doesn't need to be open. When I start to swallow food, it'll open and allow the food to pass. We'll see the same at the stomach, the lower esophageal sphincter. Okay? And we already looked at this. It's a little repetitive. We looked at this. Oh, well, here they're showing this upper esophageal sphincter, okay, UES. So sometimes in patients, you can see they have what are called strictures. These things will constrict down. There used to be a big issue with hair straightener. You know, the chemical hair straightener, okay? And I don't know if you ever noticed, or if you know what I'm talking about, and it says does not contain lye, L-Y-E. Have you ever seen that? The reason is that used to be like the thing of choice to try and overdose on, to kill yourself with. And when people would consume lye, it would cause all these sphincters and everything to completely constrict down. You have to go in and balloon it open. It was a big problem. So they removed lye from those chemicals so that there wasn't that danger, like a kid drinks it on accident, something like that. So that's why they removed it. Okay. I know weird things like this because I have a wife, I have a mom, three or two sisters, and I know more than I should know. Like I know about keratin treatments. I don't know. All right. So peristalsis, that's moving the food along. And then we have the gastroesophageal sphincter or lower esophageal sphincter right here. His purpose is to stop acid from going up. We don't want acid in the esophagus, okay? So when the food bolus gets down there, the lower esophageal sphincter will relax and allow food to pass through. Once again, in some patients, you see one of two scenarios. Either it's really constricted down and they have what's called achalasia. So they'll come in, they complain, I'll swallow like food and I have difficulty keeping it down and it comes back up whole. There's no bile, nothing in it. And then eventually it'll go over to liquids. I saw a case where the guy had such bad allergies. The eosinophils, the type of white blood cell, had migrated to that area and from releasing all the inflammatory products, had completely closed off his LES to where liquids, he could only smell like tiny, tiny bit at a time. It would take him like an hour to finish like a can of soda or whatever, and trying to. So we had to go in there and balloon it open, and then he had to go through an allergist and figure out what's causing this. The wild thing is he knew what it was coming in to see us because his mom had the same exact issue, which is kind of wild. Right? Okay. And then we'll see the opposite end of the spectrum. We'll talk about that, and that's laxity of the esophageal sphincter. And so now acid is flowing up when it shouldn't. And that's GERD, gastroesophageal reflux disease. All right, so peristalsis is that movement, and then there's segmentation. Segmentation, it'll pinch in the middle of the food bolus and mix it and churn it. And the reason it's doing that is so we can expose the outside to enzymes. So we get a more efficient extraction of food, nutrition. Okay? If the food moves too quickly through the digestive tract, that's a problem. If it's moving too quickly, are you going to absorb it? And if it moves too slowly, what happens? Never thought about that one, right? What happens? It gets stuck. What's a fancy word for food is stuck or stuff is stuck in your GI tract? Constipation. What is the number one cause of constipation? Lack of proper water intake. Most cases of why people are constipated is lack of water intake or not enough fiber. It's one of the two. Right? It's one of the two. We can see it also, like you talk about like diabetics and stuff, they develop what's called gastroparesis. So the GI tract, because of the glucose going into the nerves, water follows, damages the nerves, and eventually the GI tract just doesn't get the stimulation it should, and it slows down more and more. So they have gastroparesis. All right, so the pharyngeoesophageal sphincter, that's the UES, the upper esophageal sphincter. On tests, something like this, I'll accept UES, that's fine. If you abbreviate it, that's not a problem, okay? So this is up here. So we're talking pharynx and esophagus. It has to relax for food to enter into the esophagus. The LES, or esophagogastric sphincter, okay? The LES, lower esophageal sphincter, that's between esophagus and stomach. This must relax to allow food to enter into the stomach. It must recontract so that acid does not come up. The esophagus is not designed to deal with acid, okay? If it comes up, that's reflux. That's heartburn, indigestion. If it constantly comes up, that's GERD. That's gastroesophageal reflux disease. Okay, so here they're showing LES. If it's open, acid gets up in there, and we feel that burning sensation, that discomfort, pain. All right, so mechanical, we're talking about digestion. So mechanical, That's that chewing, churning of the food. Okay. Chemical is the enzymes. So we're going to use a protein that has a special function, enzymes, and we're going to use water to break the connection between these molecules. We have to break it down to the monomer to absorb it. So the monomers, when we talk about like carbs, are your simple sugars or monosaccharides. Proteins are going to be the amino acids. Fats, we're going to say like micelles, the very small structure. Okay. If we cannot break it down to those monomers, we cannot absorb it. The food will just go right through us. Right. When we get to the jejunum, so that's the second part of small intestine, that's where a lot of the breakdown has happened, and we start to absorb really there in the ileum, the last section. So enzymes. So proteins, okay? Lock and key. They are specific. So if I have lactase, that only works on lactate. If I have sucrase, it only works on sucrose. So sometimes lactose, I said lactate, lactose. Okay? Sometimes we have deficiencies in enzymes. It happens. Certain populations are more prone than others. Lactose intolerance, you see it more and more. In certain cultures, they do not consume enough lactose, so they develop a lactase deficiency. If the body's lazy. If you don't expose it to something, it's going to say, why am I making this enzyme? Why am I wasting this energy, and stop making it? Okay. And then a lot of times we believe what happens is you get a nasty like viral GI infection, nasty bout of like diarrhea, and immediately become lactose intolerant. I'm sure there is one of you in this room or this class or whatever that has happened to already. It's pretty common. Okay. They could tolerate it, and then all of a sudden they can't. And then you get the other population that can eat a certain amount of lactose, certain amount of cheese or milk or whatever, and they're fine. But if they eat too much, then they get the upset stomach. You're making enzyme, but not enough to meet the demand of what's coming in. Okay? The more you expose yourself to it, you can actually build up the tolerance, right? Enzymes can be used over and over again. So once it works on a reaction, once it's done, it can go back and work on it again and again, or another, like if lactase can work on lactose, once it breaks it down, it can work on another lactose. Okay. It speeds it up. Our GI tract is not incredibly long, so it takes time to break things down or enzymes to speed it up. You ever ridden the Hulk roller coaster at Islands of Adventure? Anyone? Yeah. Neat roller coaster. Okay. If you haven't ridden it, you're missing out. I grew up in Florida, nice state. Now it's really bad. It's really hot there lately. I don't know if you've been down to Orlando in the summer. Heck no. Okay. Or I've been up here too long. Anywho, Islands Adventure, neat park. It's the Universal Studios park, the other one, second one. But the way this roller coaster works, usually roller coasters, you ride to the very top and then you start going fast, right? This roller coaster, when you're in the tube going up, you hit like these rollers and they instantly speed you up to 60 something miles an hour, I think it is. So immediately you just shoot out and you start going fast. That's what enzymes are doing. Instead of letting it go slow, get to the top, and eventually the reaction could happen if there's enough time, water, we don't have the GI tract for that. So the enzymes are like the Hulk roller coaster. They speed it up. They make it go fast. So we can break down the food, we can absorb the food. Okay? Like we mentioned, enzymes, because they're proteins, specific pH. If you alter it, you denature it. If you denature it, you lose the function. Same thing with temperature. Okay? So as far as absorption goes, this is where we're going to pull those food molecules into the lining of the GI tract. In the jejunum and the ileum, we'll pull it into the epithelial cells, and then from there, we'll shift into the bloodstream. Okay? We'll also talk about lacteals for fat absorption. Fat actually enters into your lymphatics first before going into your bloodstream. It's a little different. So a lot of it occurs in the jejunum, and then the ileum is like the fine tuner. The last little like 10% typically we say. Okay? And then once we are done absorbing and we enter into large intestine, it's waste. We don't need it anymore. What's wild is of your stool, about 40% of what you pass every time you defecate is actually bacteria. The bacteria is working on the waste. It's using it as a food source. We benefit from it, breaks it down so we can actually pass it through because there's not much water left in it. We say there's about 1% water left. And then it also provides us with nutrients. Actually, without the E. coli in your gut and your large intestine, you would bleed out. They make vitamin K. The vitamin K you use to create clotting factors. So that's why when you're born, we give you an injection of vitamin K until you get populated by bacteria and move along. Okay. So this whole time it's been involuntary. When we get to this level, there is the internal anal sphincter. It's still smooth muscle. When waste hits that and it stretches it, it sends a signal to our brain that we must pass stool. Then when it's appropriate, we relax the external anal sphincter and the stool comes out. So we have control over the external. The internal is just to warn us, hey, you need to go. What's wild when you think about this, you potty train kids at what? A year? Some parents start even a little bit earlier than that. And you can train this kid to control in their sleep their external anal sphincter. Think about that. Subconsciously, same thing for the urinary tract. At that young of an age, you control it. That's pretty wild. Right? You're controlling a voluntary muscle involuntarily. Right? No? No? I don't have kids, so it's not my problem. I get to be the cool uncle, okay? That's my wife and I's jam. Yes, you should go to lab today because we're gonna go over like protocol. And you will fall behind if you miss day one. Okay? Go to lab. The lab this week. I know some schools like lab isn't necessary the first week or they don't hold lab here. We hit the ground running. All right. And this week you don't need lab coats. Next week you do. Okay. What are we doing on time? I don't know what slide I'm on. What slide am I on? I'm on 31 of 162. Fun. All right. So here they're showing internal anal sphincter. That's where that stretch would happen. Send the signal up, and then from the brain, we'll send down the signal for the external anal sphincter. Okay. Interestingly enough, there's a line here. We don't really learn about this, but it's called the pectinate line. And above that line is internal sensation or visceral sensation. Below that line is external. So when people have hemorrhoids, for example, if they have what are called internal hemorrhoids, they'll notice like bleeding in the stool, but they don't feel anything. That's because it's above that pectinate line. And then below that, if they have external hemorrhoids, they feel it, that burning sensation, pain when they defecate, stuff like that. Hemorrhoids are just vessels, veins that are like varicose veins. They're stretching out. So typically you see it from people that constipated frequently, strain when they have to defecate, pregnancy, alcoholics, liver failure, cirrhosis. So any of the hepatitis like A, B, C, D, and E, okay, could potentially cause it. And then there's actually venal absorption there. So that's where suppositories come into play. It's a direct absorption, very rapid. It goes directly to liver immediately. So that's why like babies, suppositories, fast acting. You don't have to go through this whole absorption process we're starting to talk about. Okay. Don't worry about that. I'm gonna stop here. Okay. So today I know the first week is always kind of hectic. All right. A lot of information to cover. Get you guys on the right foot. Study. On Wednesday, I'm gonna go faster. Okay. I'm not trying to traumatize you guys. I'm just trying to get you like going. Okay. We're gonna have to pick up the pace a little bit today. I went a little slower because I know you guys don't have the material yet, or just day one. But the amount of material we have to cover in this class is it's a lot. So I don't want to fall behind, right? Are we okay? Are we traumatized? I promise it's not that bad. Okay. Study, get your lecture notes, start filling them out. You can do it. I know Dr. Casey always talks about, like, do you eat a whole cow at once? But bite by bite, you could eat a whole cow. Okay. You can make it through a big meal. It's just you do it bite by bite. All right. That's how this class is. Bite by bite. Do a little bit every day. All right. Any questions? Yes.
Sure, video.
The lecture videos, when you do the policy quiz, they'll be under the lessons tab. It'll link you in there. Okay. Any other questions? Any questions at home? No? All right. I'll see y'all on Wednesday then. Enjoy the rest of your day.